Hello, what's going on? I'm going to be doing some palpations on the lower extremities. So the first one I'm going to be working on is the ASIS. Um, but first thing I should do is introduce myself. So my name is Ivan, I'm a Carrington student. Is it okay if I palpate you? Alright, last name and date of birth?
From December 11, 2003.
Alright, thank you. So I'm going to be working on your lower extremities. I'm going to be palpating through. So the first one that we're going to be doing is the anterior superior iliac spine. And a way that we could find this is we could locate the iliac crest. So I'm going to go ahead and locate your iliac crest here. So we could start medially and work our way around until we find it should start taking a turn a little bit here. And this would be the ASIS, the anterior superior iliac spine. All right, the next palpation I'm going to be working on is the adductor magnus. For the adductor magnus, its origin is in the ischial tuberosity, posterior head, the pubis, inferior ramus, and anterior head. It's going to insert in the linea aspera of the femur, and the adductor tubercle on distal femur, posterior head. For its actions, it's going to be doing hip adduction. It's going to assist with hip extension for the posterior head, and it's going to assist in hip flexion with the anterior head. It's going to be innervated by the obturator nerve L2 to L4 and the sciatic nerve L2 to L4. So I could have the client laying supine, which she already is, and we're going to have the lower legs hanging off a little bit. So if you can scoot up just a little bit, just so they can hang off a little bit. There you go. So they're hanging off now. We could locate the proximal medial thigh. So it would be between gracilis and the hamstrings. And we could ask the client to press the leg on the table, or for instance, it would be my bed. So go ahead and start pressing this. And I would locate, so just repeat this action over. So as she is pressing against the table, I can start to feel a contraction in between the gracilis and the hamstrings, and that would be the adductor magnus. So that's adductor magnus. The next that I'll be working on is gluteus medius. So I'm going to go ahead and have you lay that way, lay towards that side. Okay, so gluteus medius, its origin is going to be the lateral ilium, and the insertion is going to be the greater trochanter of the femur. Its action is going to be hip abduction. It's going to assist with hip internal rotation. It's going to assist with hip external rotation. Hip internal rotation with anterior fibers, posterior fibers for the hip external rotation and extension. It's going to be innervated by the superior gluteal nerve L4 to S1. So what we could do is have the patient laying side lying. I'm going to go ahead and roll this up just a little bit. So I can place my fingers just distal to the middle between the iliac crest and the greater trochanter. So just about here. And I'm going to place another hand here to resist movement on the lateral surface of the thigh. So what I could do is ask the patient to try to lift this leg towards the ceiling. So try lifting it up. And as you can see, I could feel a contraction as I'm resisting her movement going towards the ceiling. So that's going to be glute medius. The next muscle I'm going to be working on, or palpation, is going to be vastus lateralis. So I'm going to have you lay flat again. So just like that. The origin for vastus lateralis is going to be the lateral lip of linea aspera, the greater trochanter, gluteal tuberosity. It's going to insert in the tibial tuberosity via the patella and the patellar ligament. Its action is going to be knee extension. It's going to be innervated by the femoral nerve L2 to L4. So I could have, again, the patient laying supine with the legs off the table. What I could do is palpate the anterior lateral portion of the thigh. So it would be anterior, and it would be the lateral portion of the thigh, proximal to the patella. And what I can have the patient do is bring the leg up. So go ahead and continue this motion, bending your knee back and forth. So I can work my way perpendicularly, getting on this anterior lateral side until I get to the patella ligament. And that's gonna be vastus lateralis. All right, go ahead and relax. All right, the next one I'm gonna demonstrate is a palpation for the apex of the patella. So I'm gonna go ahead and have you sit up facing this way. Okay, so easy way to do the palpation for the apex of the patella is that it sits just superior to the head of the tibia. So I could find the head of the tibia, work my way here, and as I get here, I could dig a little deeper to feel the apex of the patella, and it's resting right above the head of the tibia. So that's gonna be the apex of the patella. The next one that I'm gonna be illustrating is the first metatarsal palpation. So I'm gonna go ahead and let you bring these feet up and have them. You could sit. So go ahead and sit, and just bring your feet up here. Yeah, just like when you were bending. Like bend your knees. Yeah, there you go. Okay, so the first metatarsal is obviously going to be on the big toe side. We have a distal and proximal phalanx, so that we have the distal phalanx going towards the proximal phalanx, and then there's a joint space going towards the first metatarsal, and that's going to be the first metatarsal that lies inferior to the first proximal phalanx. And the last palpation that I'm going to be performing is going to be the extensor hallucis longus. So I'm going to go ahead and have you lay down again that way. Yeah, so just like that. I'm going to place this under your knees. All right, so extensor hallucis longus. Its origin is going to be the middle anterior surface of the fibula. So right around here. Middle anterior surface of the fibula into the interosseous membrane, which is in between the fibula and the tibia. It's going to insert all the way to the dorsal base of the first distal phalanx of the first toe. So right about here. It's going to extend the toe at the MTP, so the metatarsal phalangeal and interphalangeal joints. And it's going to assist with ankle and foot dorsiflexion. It's going to be innervated by deep peroneal nerve L5. So what, like I said, the patient can lie supine. I could place my finger right here on the distal phalanx, and what I can do is, as I place my finger here and going along the attachments of in the line of pull of the muscle, I could have the patient raise this toe towards the sky. So go ahead and raise it towards the sky. All right. Now bring it back down. Just continue to do that. I could work perpendicularly, going through the the anterior lateral side, and I could feel contraction for extensor hallucis longus. All right. I think that's it.